from the UK Public Health England. If you Google variants of concern, UK technical briefing.
Here it is.
Okay. All right. So this is week 34 through week 37. That's going to be basically September. So this tells you the rates. Oh, yes, this is great. Rates of illness among people who have and have not been vaccinated over on the right. So what you can see is that in people over 50, rates of illness are higher in the vaccinated than the unvaccinated. 900 to 600 in people 50 to 60, 600 to 400 in people 60 to 70, 500 roughly to 360. In each of those cases, the number in the second to last graph, the second to last column, is higher. So what that's telling you is that people who are vaccinated with 2 doses are more likely to be infected with SARS-CoV-2 than people who are not infected, who are not vaccinated.
It's interesting how it changes somewhere around 40 to 49.
That's right. And there's a good scientific reason for that, which is basically there's something called immunosenescence, which basically means that your immune system, as you get older, has a harder time dealing with disease, right? That's sort of like intuitively obvious. It also has a harder time mounting the response that the vaccines are supposed to help with. So that's one chart. And again, this is UK government data, and what it says is that the idea that this is a pandemic of the unvaccinated is a total lie. You are more likely to become sick if you are vaccinated than if you are not, and you're over 50.
Older categories.
In these older categories.
So anything above 50
actually
is where
above
the number
40,
shifts.
if you see, because 40 is actually the highest number of all. There's 1,150, so it's about 1 in 100 people in those 4 weeks in 40 to 50-year-olds.
Right.